risk factors for carcinoma stomach. So first risk factor is nutritional. So what happens? Usually carcinoma stomach, it is more common in low socioeconomic status. So people who cannot afford fat. So what? Low fat or low protein consumption. If the patient is taking salted meat or fish, what kind of fish? Smoked fish, salted meat or salted fish, especially smoked fish, high nitrate consumption or high complex carbohydrate consumption. After that, see the social risk factor. It is more common in low socioeconomic status. So, social risk factor, this is more common in low socioeconomic status. Low socioeconomic status. After that, environmental risk factors. So we discussed poor food preparation. What kind of food? It is smoked or salted. So what kind of food? If it is smoked or salted. Another is lack of refrigeration. So this question was asked in a latest exam, that advancement in the technology of refrigeration leads to decreased risk of which of the following malignancy. So advancement in the technology of refrigeration leads to exponential decrease in the risk of carcinoma stomach. Poor drinking water, especially which kind of water patient is consuming? Yes, contaminated well water. So whenever there is consumption of what? Contaminated well water. Contaminated well water. And what else? Smoking and alcohol. Smoking and alcohol. So these are the environmental factors. Now see the medical risk factors. Prior gastric surgery. So if there is history of partial gastrectomy, that is going to increase the risk of carcinoma stomach. You know, H. pylori infection increases the risk of gastric adenocarcinoma. Epstein-Barr virus infection, it is also going to increase the risk of carcinoma stomach. Patient who is having prior abdominal irradiation, if patient is having atrophic gastritis, and you know, in chronic infection by H. pylori, there is increased risk of atrophic gastritis. And adenomatous polyps, you know that these are neoplastic polyps, and there is increased risk of malignancy if the patient is having adenomatous polyps. After medical risk factor, see the occupational risk factor. This was asked in one of the NEET SS exams. Occupational risk factors, and it is seen in which particular occupations? Rubber and coal workers. So there is increased risk of carcinoma stomach in rubber and coal workers. Increased risk in rubber and coal workers. After that, genetic factors. We discussed that it is more common in males. So male gender, which blood group? You have to remember blood group A. It is more common in pernicious anemia, and we discussed that in pernicious anemia, where is the malignancy? So the most common site is the fundus. And positive family history increases the risk. Patients who are having HNPCC, hereditary non-polyposis colorectal cancer. So in these cases, there is extraintestinal malignancy. One of the common site is stomach. And in Lee-Fraumeni syndrome, which is autosomal dominant condition, in Lee-Fraumeni syndrome also, there is increased risk of gastric cancer. So this is the list. This list is very, very important. Almost every year, there is one question from the list.